Telemedicine can improve the quality of stroke care and provide specialized care 24/7 for hospitals that don't have 24/7 specialists, and also can support transfer from different levels of hospitals with very good quality. So here talking about the telemedicine. And public awareness, so important to engage the community about the stroke signs and fast activate pre-hospital and put the patient in the right hospital for the treatment. After the organization, the certification can ensure that everything that is evidence-based is implemented. So we implement the World Stroke Organization certification, but there is others, and this program really qualified the services. I'll talk more a little bit after. Always continuous educational program in the hospital level, in the regional level, society level, and country level coming from the Ministry of Health will be so important. We have free teaching course in the World Stroke Academy, in the Angels Initiative, and for mechanical thrombectomy in the Mission Thrombectomy too, that can support local teaching course. We create the Global Stroke Alliance to put together stroke specialists and health managers, mainly the ministers of health, and this can guide the government to the best national policy for stroke. So we can do this together. Critical challenges and barriers to implement: structural barriers, inadequate infrastructure, limited availability of CT scan, 24/7 emergency rooms, cath lab, lack of physical space to build the stroke units, insufficient human resources in several countries. They don't have physicians or nurses or physiotherapists or neurointerventionalists trained for acute care. Limited multidisciplinary teams, so occupational therapies, speech therapists, sometimes we don't have in the country. Financial barriers with sometimes using unapproved medication, high costs of treatments, as mechanical thrombectomy is cost effective, but needs to be affordable to everybody, so needs to be paid and for free for the patient. Patient cannot pay out of pocket. Also, inadequate alteplase doses, for example, only 50 milligrams available, so we waste medication. Now we will have 10 hectaplase, and I hope for a cheaper price. Inadequate reimbursement, so really we need this for free for the patients, included in the universal health coverage packages, and patients' costs. So several times the patient don't receive the treatment because of the cost for the patient. Organizational barriers, service fragmentation, lack of protocols, non-existent network organization, inadequate monitoring, and without data collection to monitor the quality and the results. This is so important. Knowledge barriers, insufficient awareness for the population and for health managers and for the health professionals, lack of training, limited public knowledge, and absence of guidelines. So we need to put everything in protocols, train everybody to really improve the access and to have good outcomes with the best treatments. Solutions and overcoming strategies. We need service integration with multidisciplinary teams and task sharing tasks, expanded training for nurses, physiotherapists for swallowing assessment, as I told you, educate patient and families for basic rehabilitation, free virtual programs to educate all health professionals, telemedicine solutions to have access to the treatments in areas without specialists, financial sustainability of these strategies. Negotiation is very important to decrease the cost, and advocacy to put this in a national plan. Here, We have the example of reduction of the cost of alteplase as we had in Brazil, and availability of vials of 10 and 20 milligrams presentation that decrease the total cost of the treatment. And tenecteplase potentially more accessible alternative, and the world is changing for tenecteplase now. We need to show cost effectiveness demonstration to include these treatments in universal health coverage, and these need to be prioritized by the government. The government that have the money, they need to prioritize to put the money in stroke programs. And innovative financing, local and international partnership for complex service development, innovative financing mechanisms for expansion, prioritizing of stroke in public health agendas for resource allocation. This is fundamental. So expected outcome, effective implemented even in resource limited contexts through intelligent adaptation and strategic prioritization. Essential collaboration, partnership between stroke specialists, ministers, and international organizations are crucial to overcome barriers. In local adaptation, solutions must be customized to specific needs and available resources in each region of the country. So we'll show the example of the implementation task force we create 2022 in World Stroke Organization, chaired by me and Professor Bonovrin, with several different areas with the co-chairs in each area. Here are the meetings. We have more than 150 members in different parts of the world to help implementation. Our goal is to implement everything that is evidence-based globally, and also support the engagement with the governments. So for acute stroke care, we are based on the World Stroke Roadmap that classifies the services in minimal, services without reperfusion therapy, essential, services with thrombolysis, and advanced that has thrombolysis, stroke unit, and neurosurgery. Of course, essential, we want also stroke units. The idea is that stroke units is the basis of all levels. These services that are minimal, we also have several activities, several recommendations that can improve the quality of access of the patient and quality of outcomes. For example, swallowing assessment, early mobilization, management of blood pressure that can decrease mortality, mainly in hemorrhagic stroke, when we can see a huge decrease of mortality of better basic care for the patients. We have the roadmap online, so you can use for free. You can test yourself and see the status of your hospital, and easily to see what need to implement to be better in different levels. We have experts advisors for implementation. For example, the case of Ethiopia that we start advising by virtual visits, evaluate the services, meeting the director of the hospitals and the team to help them to create the basic stroke units, to create the teams locally in 3 hospitals in 2 cities in Ethiopia. And here are on-site visits. You can see the stroke units there. We had rounds at the bedside, discussing the cases, teaching course, virtual, in person, and here we implement a telestroke mobile app to support them by distance through the Telestroke Without Borders, supporting them in real time with experts in different parts of the world, giving real-time support to evaluate CT scan, discuss the case, and start intravenous thrombolysis. One day after the in-person training, they start thrombolysis that we donate to the Ethiopia to start as the model for a low-income country. Here the discussions with the Ministry of Health for continuity and other health managers. The same with Ethiopia, led by Sara Matuya, our future leaders, here the representatives of the Ministry of Health. She's really leading the country together with Ministry of Health, implementing stroke centers, in-person discussions in 5 hospitals in 3 cities with in-person training too. and memorandum of understanding with the hospital and Ministry of Health. We donate TPA to them through Beringer Ingelheim initiative, initial to Ethiopia and Tanzania, and now with all these countries, with a strong educational program, virtual and in person, through World Stroke Organization and the African Task Force Group from WCO, plus partnership with African Stroke Organization and our future leaders. The same in Colombia with a memorandum of understanding with Ministry of Health of Colombia last year. We start to implement and certify. The plan is 20 acute centers and 20 rehabilitation centers. We create a certification program to ensure that everything that is evidence-based is implemented through a virtual platform. They can fill the form and see their status. And after this, when they are ready, they apply for certification, include the documents that are requested about the training of the professionals, the structure of the hospital, medications, device, quality indicators, results, regional network, and you go there to visit. Here in the platform you can see the name of the hospital, this distribution, and the type, if it's advanced or essential stroke center. We start in Latin America, 13 countries engaged, 11 already have services certified. Here in-person visits, evaluating the process, the protocols, the equipments, medication, device, the teams, and the quality indicators registry compared with the medical records to validate the quality indicators. Here, the first 39 Latin American stroke centers certified. Now we have 3 weeks ago, 100 hospitals certified in this region, 13 countries participating, but 11 until now with hospitals already certified. And from this, we expand to the rest of the world, starting by India in 2022, end of 2022. 2023, August, we start in Turkey, January 2024 in Egypt, that now Egypt has already 14 hospitals certified. Here, our pleasure to visit Indonesia and Malaysia. And here, a co-brand certification with Australian friends. So a huge impact of the certification here in Latin America. You can see already we are recertifying the hospitals after 2 years. Now expanding, we will have the certification each 3 years. Here the countries are already participating in the certification. From the first application to evaluate the self-assessment, the status of the hospital, until the implementation, the improvement of the recommendations implemented in the hospital increased from 71 to 92%, a huge improvement we can see in the hospitals participating in this program. And now we have more than 1,000 hospitals that use the roadmap to guide them in the improvement, and we have much more, now more than 200 hospitals in preparation for certification. In Brazil, we already have regions where this certification is mandatory for reimbursement of public health system. This is really amazing. Here is the map. Now we have 20 countries already participating in the certification program. We have a strong educational part, so you can use our World Stroke Organization in English teaching course for stroke centers, for hemorrhagic stroke, ischemic stroke, stroke scales, and now you have also for rehabilitation and prevention. We create a Global Stroke Alliance to put all efforts in implementation together, researchers, health professionals, health managers, scientific societies, private hospitals, industry and patients associations, working together in implementation. These meetings bringing regionally the Ministry of Health and stroke specialists to discuss national plans. Works very well. We start in Brazil, after here in Uruguay, after expand for Southeast Asia in all these countries, after the Istanbul for Central Asia and Middle East region last year, and this year we had the first time in Vietnam, also we had in Colombia, this year again in Panama. So a lot of improvement because of these meetings with health managers and specialists creating national plans for stroke. Here just to show the result of these meetings in Latin America, where we start since 2018, we published these 12 countries in 2020, and we saw initially we have only Brazil and Chile with national plans. In 2020, we have already Costa Rica. In 2023, we include more Uruguay, Ecuador, and Panama that will support them to develop national plans. After Colombia, Paraguay, and this year Dominican Republic. And regionally, Argentina and Mexico. We have in the region 9 countries a national plan, and now Argentina is starting a national plan and expecting to have the next year the Global Stroke Alliance regional there. So this is amazing. We can see the quality indicators improving in the structure of the hospitals, improving, implementing not only the hospitals, but everything that is evidence-based, step by step, from primary prevention, pre-hospital, acute care, rehabilitation, education of all professionals in population, and research in stroke. And here we have the Global Declaration on Stroke. Please take a photo of this QR code, read and sign this declaration, because really here we have step by step everything that is important to be implemented in a national level. And to finish, we are working globally together. World Stroke Organization launched the Global Stroke Action Coalition, put together all strong international societies, so World Stroke Organization, American Heart, American Stroke Association, European Stroke Organization, Jim DeMarsh in Canada, UK Association in United Kingdom, Asia Pacific Stroke Organization, and very important industry partners working together to put stroke in the global agenda, to put stroke in the universal health coverage, asking to the health managers to make stroke a priority, development national stroke action plans, commit to funding stroke action now to fund stroke in the country, implement robust stroke monitoring system, and include stroke survivors and caregivers in policy developments. So we are asking for government policies, healthcare infrastructure, international collaboration, and community engagement. This is our meeting with the ministers during the United Nations General Assembly, a huge success, September this year. Here is our roadmap. You can see in the same paper, reads up in Journal of American Heart, where we put all the strategies from the World Stroke Organization for implementation. And in conclusion, with this strategy, I show you we can implement acute stroke care everywhere, and we need a global transformation of stroke care with collaboration among health professionals, managers, policymakers, scientific societies, international organizations is essential to overcome the barriers and ensure equitable access to quality acute stroke care in all countries, especially in low and middle income countries. Thank you so much.
Thank you very much, Profesor Sela Martin, MD, PhD.
Terima kasih kepada Profesor Sela Martin, MD, PhD. Telah tampak pada layar ini barcode dari sponsor kami dari Kalbe Genomic untuk sesi internasional yang sangat menarik ini. Kepada para hadirin dapat mengisi barcode terlebih dahulu, kami berikan waktu untuk mengisi barcode.
Semoga sesi ini dapat memberikan manfaat dan pengetahuan yang luas untuk kita semua.